Thank you for joining us on this episode of SeniorLivingGuide.com podcast. If you enjoy this podcast, we have over 30 episodes of Senior Living and Caregiver Resource podcasts that you can listen to and follow most anywhere you enjoy music or podcasts, such as Spotify, Apple Podcasts, Google Podcasts, even Alexa, and many more. So please don't keep these podcasts all to yourself. Share them with a senior or a caregiver who you think will benefit from the support that we provide. I am your host, Arlene Mahoney. I'm excited to share the news that SeniorLivingGuide.com provides a one-stop shop to finding senior housing, including independent and active seniors, a new home, while providing an excellent resource to assisted living, skilled nursing, memory care, or even home health and caregiving services solutions in one easy-to-navigate website. So visit SeniorLivingGuide.com today. I would also like to thank our podcast sponsors, Parish Healthcare and Parish Medical Center. At Parish, they offer the Parish Senior Consultation Center and Parish Senior Solutions, where each patient's evaluation and follow-up care will be personalized to meet the needs of the individual and their families. So today we're going to chat a little bit about the stigma of skilled nursing. And I would like to introduce Adrienne Cordero. I think I said her name right.
You did.
Yay. She is the care manager for Vieira Health and Rehabilitation and Rockledge Health and Rehabilitation Centers. Adrienne has been in healthcare for over 10 years, helping seniors throughout Brevard County, which is located in Florida, over here on the East Coast, Space Coast, actually. And she partners with local hospitals, assisted living facilities, home health care, etc., to help patients find placement in a skilled setting for either therapy services or long-term care services. So we're going to talk a lot about that today, and I'm super excited because this is a subject that can be really scary for patients and their families making some of those transitions.
Absolutely. I see it every day.
Exactly.
It's scary. The unknown.
Yeah. And many patients, they go to the hospital, they're not prepared, and they don't have the knowledge of what rehabilitation is and what to expect. So can you tell us a little bit about the process and what that patient and their families need to get prepared for that?
So in most cases, when a patient is going to the hospital, it's due to a hip or a knee fracture or a stroke or maybe even a CABG, which is a cardiac surgery for the heart, obviously. Sometimes they know ahead of time if it's a scheduled surgery, but if not, then it's emergent, right? So they don't really know. I honestly think that if you're over the age of 65, whether you have any planned surgeries coming up or not, to go ahead and look. Look online, ask around your friends or family, see what's close to you. Obviously, most people choose their skilled nursing or nursing home, however you want to say it, location due to what's closest to them. But don't forget, there are so many other elements. What type of therapy programs does a rehab center offer? At our centers, I don't know about other ones, but, everything from physical, occupational, speech, respiratory, hand therapy, tons of different consulting physicians, and so on and so forth. Not that they need to know all of that. However, they need to know that it's going to be appropriate center for that patient. And of course, some of it you're not going to be able to know ahead of time. But the number one thing that they need to know, whether they want to do the research or not and look around or ask around, is just know it's always patient choice. So yes, of course, the hospitals or the ALFs, they want to get a patient out because they need that level of care. They need us, meaning skilled nursing, which will help with 24-hour nursing care, medications, doctors, and more importantly, the therapy. So that's all that skilled nursing encompasses. But the number one thing that patients need to know is that they have the right to choose, no matter which entity of healthcare they're coming from, to go to a skilled nursing center. And sometimes it's very rushed in healthcare because we have to act upon a discharge order from the physician. So it may feel rushed for them, but all they have to know is calm down. I know that, we're go in healthcare, and the patient needs to understand it's okay. You have every right to slow us down.
I love that because I think that is one thing that people don't realize is that they absolutely 100% have a choice.
Absolutely.
On where they
get kind of, not to say that healthcare workers push it on them, but they kind of do. They say, you need to choose, and you need to choose now.
Right.
But take your time. If that means you take a couple hours even, I get sometimes maybe people feel they need more than that. But it's as simple as asking their family or they themselves, looking at their websites, making calls, sending family members out to do tours. There's a million and one things that you can do. Ask your neighbor if you're in the hospital.
Getting a referral.
You know,
where did you go? Where did you have a good experience? And you mentioned something at the very beginning, which is something, I'll be honest with you, I never thought about, but it's a great idea. If you're over the age of 65 or you're getting up there, to tour some and just get an idea. If this happens to me, this is what I prefer to do. This is a skilled nursing that I choose to go to. And you go and you tour it way beforehand.
Yep.
You walk around, ask questions. And some of the things you need to do is you need to talk to the people that are there, not just the staff. How do you like it there? Check out the food. Food is huge. You really want good food. And just kind of, ask other family members that are there visiting their loved ones, what do you think about this facility? Are you happy with it? Are you happy with the results that you're getting, the communications with the doctors and the staff? Those are huge things, and getting that information directly from other family members that are there is great.
Absolutely.
And to do that way beforehand, before you ever need it.
Absolutely.
Yeah.
And I'd say if you're being that far ahead of time, again, before you have anything planned, before anything were to happen, before you ever even think about being in the hospital, that would tour 3 of them. You have time. You're doing it. You do 1 a week. Well, while you're thinking of it, and really take notes, even and ask those questions, like you said.
Yeah.
I always like to look at the nurses station. So again, I've been in skilled nursing for a really long time. Kind of look at how the nurses are interacting with the patients. It says a lot. Now, mind you, we're humans taking care of humans. Are all of our staff going to be the best ever? No, but I know my company tries to hire the best ever, but it doesn't mean everyone's top notch, so to speak. But for the most part, everyone does care. And if you can see it, that goes a long way. Obviously, in your care for a place that you're staying for a short or possibly long, amount of time.
Right, exactly. And that is a relief off of the stress. You can knock that off your plate so that if you need it, and make sure you indicate that to your family.
Absolutely. So tell them, put a little card.
Yeah.
Of course, any place you tour is going to give you brochures or business cards. Keep your top 3 choices in your wallet or in your purse. That way, if for some reason you do wind up in the hospital, boom, you can say, these are my top choices. You don't even have to remember their names.
Right, exactly. So it's already set, it's decided, and that's just one more thing you don't have to worry about.
Absolutely.
And then it makes it much more of an easier transition if you ever need that. Because I do know that, with a lot of families and that person that's in the hospital when they're making that, going into a skilled nursing or rehab, it can be a very, very scary thing.
Of course.
Yeah, so it's so nice to be able to just have the ease of that.
Absolutely.
Off of that. So what some of the things that you were talking about, like one of the things that a lot of seniors go into skilled for are falls, and that's like one of the biggest ones.
It really is.
Yeah, for a lot of seniors.
Yeah, and people don't realize too, once they come to a setting like us, we're responsible if they were to fall with us. So our goal is to teach them moves that will create balance and create strength on the lower part of the body. That's through physical therapy, kind of almost reteaching them how to walk. Because if you notice, most seniors, especially if they have a bad back or they've had surgeries or what have you, they're hunched over, they shuffle, they have the wrong equipment. That's one of my favorite things about my job, because they are able to get the proper, we'll measure a patient to ensure that they're standing upright, it's the perfect length, everyone's their own height and weight, so they need their equipment, whether it's a wheelchair, a walker, a cane, to be properly adjusted to their bodies. And a lot of the time they'll come to us wondering why they have all these falls, and that's a big part of it. You know what I mean? On top of a lot of kind of detrimental things that are in in their homes. So not only is their equipment working against them as opposed for them, but then also they have too many rugs in the home and, too many corners, just too much, to where if they were just taught properly by the right professionals, then, falls can be a little bit more preventative. So that's our goal, not only building up strength and balance, but teaching them the safe way to go about their day at home.
Yeah, I know we've done some podcasts on safety at home and beyond, even safety when you're out and about, getting in your car, walking around stores. So all of these different things that
absolutely
are huge, because we've also talked about once a senior has a fall, it can alternate how they live the rest of their life.
It could change everything.
Absolutely.
It can change everything. If you really think about it, it's not just seniors, but of course it'll affect a senior more depending on what's going on in their bodies. But yeah, it's scary. And believe it or not, or I'm sure you talked about it in your last podcast when you spoke about falls, there's a right way to fall too.
Right.
A lot of seniors don't know that either. Instead of falling and they think they need to just put their arms out, but no, that's how you break arms. That's how you break your hip, by trying to do it. I always tell anybody, if you're falling, roll with it, and just make sure you don't hit your head.
Yes.
Those are the two main things.
100%. So just a short list of what are some things when you do pre-visit or decide to look or need skilled nursing or rehab, what are some things that should be priorities to people, that if they were going to do a little checklist of
That's a
priorities?
great question. So obviously know your insurance, first of all. Make sure that facility can accept your insurance, because each facility has contracts with certain insurances. Of course, everyone and their brother takes Medicare.
Right.
But if you have a Medicare replacement, such as United Healthcare or Blue Cross or even the VA, it does depend on that contract with that center.
Okay.
So make sure that's one of the top things. Again, ask about those therapy programs. Ask specific things about that therapy program. If you have certain, say you're a fairly active senior, but you're just trying to be prepared and you go through, ask to look at the rehab gyms, which of course they're going to show you, but look around. See if people are really and truly being active and engaging and listening to the therapist and have trust in them, because that's a big venture as well. Another thing you definitely, I wouldn't say you should ask, you should do it on your own time when you are researching, but look online, look on the reviews too. There's a lot of places that, now, mind you, some of the reviews online are old, so make sure you get the most up-to-date. Maybe look before you go and then ask, because sometimes it's as simple as new administration. So maybe the center didn't have a very good reputation for a while just because they didn't have a great administrator at that point. And thankfully, we're very blessed with great administrators in this county, but it can deter, customer service in a facility. So ask questions like that, basically. Ask what are the kind of ins and outs and processes for customer service, because again, we're humans taking care of humans. And people also forget we're not a hotel. We're here to care for you. Yes, you want a certain type of room, we'll do our best to give it to you, but just remember, they're here to help you get better. They're not here to wait on you hand and foot. There's a big difference. We want to wait on you, and we want to give you the best possible experience, but especially after COVID, God bless all of healthcare, the staffing was really effective in every single place because people got scared and they ran.
And the staffing is getting built back up.
Totally. It's much better, but there are still some centers that, I'm sure struggle with it. It's on that struggle bus.
Exactly. So you talked a little bit about insurance coverage for rehabilitation. So do you want to cover a little bit about how that works as far as the time frame and some different things on that? Because I know that is definitely a little bit unique.
Yes, it can be. Again, it depends on the contract with the facility.
Okay.
The good news is most places that are skilled nursing facilities have folks like me, care managers, that will help with the entire process from beginning to end. So say you're in the hospital, whether you scheduled to be there or not, you decide Viera Health and Rehab is close to me, so I'm going to ask the case manager to send the referral out, right? They send it out. I review the clinical information. And of course, one of the first things I'm going to look at on that face sheet is the insurance, because I want to be absolutely positively sure that I don't waste anyone's time before knowing if we can properly accept that insurance. Then, of course, the clinical review. Once I've reviewed and I know that I can take the insurance, I can, I'm able to properly care for the patient at my facility and we are a safe place for them, then I will go and talk to the patient and the case manager, start the authorization if it is an insurance, again, such as Blue Cross or Care Plus or any of that. Typically, the number one thing you need for that is an updated PT note in the hospital, and you fax all that stuff over.
Okay, so I'm going to take a step back because you used a fancy term. It's not fancy, but you said the word a PT. So explain to us what a PT is. I don't even know what I'm saying anymore. No, it's all good because, I don't know what that means and probably a lot of our listeners don't. So explain to us what that is.
Thank you for stopping me. Like I said,
100%.
Healthcare folks are a sucker for any acronym.
Yes.
So PT note means physical therapy note.
There you go.
So as you know, skilled nursing and rehab centers, we specialize in therapy.
Right.
But in order to get insurance off, that's why hospitals typically have an entire therapy staff. So the physical therapist needs to see that patient so they can gauge as to how well or how not well they're doing in the hospital. Then the insurance company, once they read all that information, can tell us yes or no on either approving or denying the patient's insurance to come over to rehab.
Okay. Yeah, because the primary goal typically, just starting from scratch, of rehabilitation or a rehab facility is the physical therapy once someone's been in the hospital.
Absolutely.
So they can either return home or to their assisted living, correct? And I do know, or correct me if I'm wrong, because my dad went to rehab, and the goal is to be able to stand and pivot in order to return to assisted living. Is that correct?
Correct. That is the standard for any assisted living.
So I just thought I would notate that because I know that is a question that I've been asked multiple times, is what is the standard in order to return? So that's very interesting. So I think we're going to take a quick break, and then we're going to come back and we're going to talk about how long does a patient need to stay in a rehabilitation center?
The $1 million question.
The $1 million question.
Hey, Mom, how's the retirement home search coming?
Oh, my gosh. I'm just so stressed out. I don't even know where to begin.
Well, why are you so stressed? What's the matter?
I don't know where to find anything. I just need everything in like one place and know what all the options are.
Does the idea of searching for senior housing seem overwhelming and you just aren't sure where to even begin? SeniorLivingGuide.com has great news for you. We offer a one-stop solution to take the stress out of your senior housing search. At SeniorLivingGuide.com, both our statewide Florida edition book and website are created to make your senior housing search very easy for you to navigate. We provide details on communities, including retirement, assisted living, skilled nursing, memory care, and home health, allowing you to decide which best fits your needs and then connecting you directly with those communities. Visit us online at SeniorLivingGuide.com and start your search today and start de-stressing.
At Parish Healthcare, we believe every life is poetry in motion, motivated by strength and determination. As your bone, muscle, and joint healthcare partners, we believe in blending the art of healing with the science of medicine to keep your body in motion. We believe in healing patients, healing families, and healing communities. For a free orthopedic health assessment, visit parishhealthcare.com/orthoaware. Parish Healthcare, where the art of healing comes to life.
And welcome back, everyone. And we're going to go into the $1 million question with Adrienne about how long does it take a patient to recover during rehabilitation, as far as what is the expectation? Because I know that people, when they go into rehab, they think they're going to be there for a very long time. At least that's kind of what people are thinking. So give me the download on that.
I must tell you, I get this question and that fear of a skilled nursing facility keeping a patient or keeping them, the patient,
right,
forever or for, too long, or using all their Medicare days for 100 days. That's kind of, it's way in the past. Like basically there's now certain things through Medicare and CMS, which is the Medicare.gov, which shows our star ratings for all skilled nursing facilities. There's a lot of guidelines in place to where we cannot do that anymore. So I can assure you, that's not going to happen. We are not a jail. We're not ever going to keep anybody against their will. And I think that's why there's such a stigma, because before these rules and regulations were really out there, some patients were, winding up staying long-term care or way longer than they really needed to be for a long time. So basically, the long way to answer your question is the average length of stay for us and most skilled nursing facilities is 7 to 14 days.
Wow.
It is deterrent on their insurance. So say they're a Blue Cross and they're not doing so well. They've already been there maybe 10 days. So then our therapist will send over our therapy notes to the insurance company, proving that, they're making some progress, but not as much as they really need to in order to go home safely, therefore extending the insurance approval. When it's Medicare, it's similar. We just have to prove it to Medicare in order to get paid, but you don't need approval for it, so to speak. So, but they can stay a little longer. And just to kind of cover this while we're talking about it, the way that Medicare pays is days 1 through 20 is paid 100%. Again, our average length of stay is shorter than those 20 days, which is perfect. So then you never hit a copay day. But if they were to need to stay past that day 20, days 21 through 100, when Medicare is your payer for a skilled nursing center, it's paid 80%. So then that 20%, it does change every year. Per Medicare, we just got to follow it. So I think it's about $170 a day for the copay. But again, if you have that coinsurance, we can bill the coinsurance too. So hopefully that will help a little bit in regards to full coverage. But same thing with an HMO. An HMO won't have that kind of cushion, so to speak. If it's not a Medicare replacement HMO plan, again, like United Healthcare or so on and so forth, then who knows? We have to abide by that plan as to when the copay days are. Therefore, we have to call to get benefits and see exactly, how much would possibly be out of pocket for the patient if they were to come to us.
Right. Gotcha. So you mentioned a website.
Sure.
So go back and mention that website again that provides
CMS.
Okay. Explain to me what that is.
So again, it's to gauge each skilled nursing facility's star rating. So it is basically monitored by Medicare and the state. So for us, it's Florida, obviously, state.
Right.
And what they do for all skilled nursing facilities, it's mandatory that we get surveyed once a year.
Okay.
The only other time they would come to us is if we have a complaint and somebody called the state, which is fine. We just show them all the documentation and, prove it yes or no. For state, they go through every aspect of a skilled nursing facility. Everything from the rehab portion, making sure we're following those guidelines. Of course, now with COVID, make sure we're following those CMS guidelines, meaning if it's a patient's unvaccinated, then we have to isolate them. If the patient is vaccinated, then fine, they can cohort with other vaccinated patients and make sure we also have a recent negative COVID from whatever setting they came from. That's within, 48 to 72 hours. Those are just typical CMS guidelines. But they'll also check on staffing ratios and nursing ratios and administration. And it's literally is ensuring that your loved ones are fully quote unquote investigated. It's kind of what it feels like for us, and it can be quite stressful and taxing on a center because they will check everything as they should, you know, and fair is fair. We're here to give a service, but how dare we ever, as a service to seniors, I would never want to abuse the fact that we are here to care for them, and they deserve a wonderful, wonderful next stage of their life, you know?
Absolutely.
So.
Right. Yeah, I know that when my dad was in rehab, it was very stressful for me to have him up there. And I would go up there every day and sit with him. And it was probably one of the hardest times, just getting him out, getting him fresh air, and just having him there. I just wanted him to come home. You know, you just you just feel like that was just a stage, and it was a portion of between the assisted living and getting back out of assisted living. But because he had experienced a fall is what it was. And I mean, it was the fall that, you know, that just kind of, he had dementia. So it was really the fall that ended the end stages of dementia. But at the end of the day, it was just, you know, it's just a different part. It's just something kind of we had to power through. But, so I think it is really important to just make that experience, or any experience for a senior, because at some point we're probably all going to have to experience it, and we want to make sure that if we set it up right now, that it's still going to be a good experience for us when we get there.
Absolutely.
I always think about that because we are all going to get old.
Yep.
So
the inevitable.
I know young people don't think it's going to happen to them. I used to think the same thing, and then I continue to get old. So it's going to happen, and I want my experience, if it happens to me, to be a good experience. So, you know, setting it up now so that it's a good experience when I make it there. So it's important for that, you know, for that reason as well. But
can I ask, was your father in a skilled nursing center during the pandemic?
No, my father passed away right before the pandemic.
Gotcha.
Which I will be honest with you, and this may sound terrible that I'm saying that, but I'm glad that I didn't, because he did have dementia, and I did see my father every single day. I don't know if I could have done it.
Without seeing him. That's the only reason why I brought it up, actually.
Yes.
To see the frustration and feel it. Like, I felt it in the pit of my stomach every day when they made us lock it down and not have anyone have visitors. And not only did that take a toll on their kids and their loved ones and their family, it took a toll on the patients themselves.
100%.
I would make a point for my cute little patients that would come up to the front, because that's where they kind of stationed me during it. Of course, I too was locked in the facility, not really able to go anywhere like I usually do the hospitals.
Right.
And the folks that would come up there to at least get some sort of socialization, of course, outside of our wonderful activities, they did the best that they could given the circumstances. But we too, I think we all felt like we needed to engage more. We needed to make sure we did something more. So I would make sure all of my lobby crew didn't have diabetes, weren't on any sort of restricted sugar diets, and I'd bring them candy every day. You know, because they can't see their kids. And a few of them, they would wait too, thinking, again, maybe some of them had dementia. They'd be out the window thinking their son or daughter was coming to see them. And they weren't.
I will tell you, we haven't really on this podcast really talked a lot about COVID or the effects of COVID on seniors, because it's just not a subject we've really, approached. But I don't think people outside of the senior living community, people that are, living their everyday lives, really understand the toll that it took on the seniors within the communities, clearly the staff as well.
Oh, it took a toll on everybody.
Just astronomical. They think it was hard insane on, everyday people, and they don't understand the gravity.
Absolutely.
Of the devastating effects that it had on our
seniors. Think about folks that were long-term care, meaning they stay in a rehab center that's their new home. They befriend and almost have our staff become family, and then they too get sick. Right. You know what I mean? So it affected them, whether it was anxiety or depression, or also the staff, like trying to be extra cautious and just going to get groceries and like, oh, will this affect my patients when I go to work tomorrow? Because, I'm here at the grocery store, or so on and so forth. It was very scary in the beginning, not just for us, but for the patients too. And,
100%.
And I'm so glad we're on a better side of this pandemic now. We know more, we're less scared, we have more knowledge. Of course, we have the vaccine, but on top of that, it's more everyday knowledge now, you know what I mean? So
we have so much more understanding, and I think that is huge versus, before, so many people were like, I know we're completely gotten off topic, but the wiping out of the groceries, things like that.
Oh, totally.
That we've at least understood that
the toilet paper. What was up with that?
I don't know.
Get a bidet. No,
I know exactly. And now I'm thinking I need to go home. I actually am getting short at home. I probably need to stop by on the way home. But getting completely off topic. One of the things I wanted to ask, I know that some people talk about like the census, which I don't know if, like normal seniors, caregivers really understand what that is. But
hopefully not. They don't need to.
Right. But that has something to kind of do with maybe the long-term thing, which we've already really kind of, covered.
Right.
But so that's not ever something that is utilized in order to maintain residents longer.
So here's the deal. Like I said, back 10 years ago, 12 years ago, that's why. Census was the reason why skilled nursing centers were keeping patients for all 100 days of their Medicare days, because they wanted to maintain their census. So to kind of just cap overall, census for any skilled nursing facility is the business money-making side of it. So that Medicare, that HMO, even that Medicaid long-term care patient is what's making money to pay for all these, staff members' salaries and for all the things we need to properly take care of the patients. So the higher the census, the more money you're making.
Right.
So again, in a way, it was abusing the system, if I'm being totally honest. And that's why I'm so happy that now there are those mandates and there are those caps. Like, hey, we're not going to pay you if you keep this patient any longer, or at least they're going to look at it a little bit more closely and be like, hey, they're ready to go home. They're doing okay. So again, that way nobody abuses the system just to maintain a business-like census.
Right. So let's cover just a tad the stigma behind the skilled nursing facility. And I think we've overcome some of those stigmas from the days of old. I think that there's been some big improvements.
Oh, absolutely.
So let's chat about that a little bit.
I'll say this right now. Skilled nursing centers now run the way hospitals did 10 years ago. So that is not only showing leaps and bounds in healthcare in general, because, the things that we can do, the fact that, is hospitals can do way more than that now, maybe a little slower, but we can still do it. Draw labs, do blood transfusions, not all centers, but some if they have the capabilities. To have the amount of consulting physicians that we have on board is amazing. They never had that. They probably had like one doctor that was there for the whole shebang. Or is kind of taking advantage of staff too back in the day, not having these Medicare guidelines for the nurse or CNA, which is, a nursing assistant, certified nursing assistant. Sorry, me and my acronyms. Yes. But, there was no ratio for them. Therefore, they would probably have way too many patients than they were physically able to even take care of, which again is a hindrance to the staff as well as the patient. So having these guidelines in place not only help break the stigma for everyone as a whole when it comes to skilled nursing center, but also hopefully helps prevent the fear when you are in the hospital or you have a loved one in the hospital that does need to go to a rehab center. I will tell you, at least 3 times a week, I get that fear, that question. Oh, are you going to keep me there forever? Or are you going to keep me there against my will? All the time, I say, we're not a jail.
Right.
That's not what we're trying to do here. We are just trying to get you stronger, get your balance back a little better, help you, do those everyday life type activities and teach you how to do it in a better way, and then get you back home.
And one of the things that you should be able to get are meetings, recap meetings like once a week or something like that with the family and the patients to see the progress being made.
Absolutely.
So it's not like you get in there and then one day you're just released.
Yeah, no, it's not like that. So the wonderful thing about my center, and as well as, I'm just trying to give props to my administrator because we love you, Derek. He is wonderful about doing what we call a magic meeting. So say that once the patient's there, has been evaluated by nursing, been evaluated by therapy, and therapy gives kind of a projection discharge date, then they'll call either the patient or the patient and their loved one, their power of attorney or just their next emergency contact. Schedule a call or an in-person meeting now that, we're past all the COVID crisis a little bit, then, now we can meet a little bit more in person. And they kind of go over everything.
Okay.
Any customer service issues, this is your projected discharge date. What is your plan for discharge? We'll also check to see, in accordance with the physical therapist, do they need any sort of equipment? So yeah, like I said, they may have come in with an ill-fitting cane, but really what they need is a walker and a certain type of commode for when they go home to make it safer when they get up and down. So those are the things that our discharge planner can help order through their insurance or Medicare to make sure it's already there or on their way by the time they're leaving our facility and discharged from us. So those are some of the things that they'll go over. And again, our administration is more than happy to give our loved ones and patients his cell phone number. So if you have any issues, day or night, you can call him or text him. It makes it better.
Right, exactly. So those are expectations that you want to look for.
Absolutely.
When you are in that facility, that type of facility. And beforehand, before you go in, ask, this is what I can expect once I go in this facility. These are the things that I want.
Yep.
100%.
Tell them, ask them.
Exactly. So we talked a little bit about the research, and I'm going to reiterate the website that you mentioned. It's super easy, www.medicare.gov, to look for those CMS star ratings on that website. Is there anything else you want to kind of add to that?
I will say when I went over the survey that the state comes in and does, excuse me, for each center like ours, the outcomes of what the state found are in detail on that CMS website on Medicare.gov.
Okay.
So not only will you see the overall star rating, which, by the way, it's rating 1 through 5, but you'll see each individual point that state did their investigation on and see what their star rating was, not just overall, but for each department or each thing that they found. So it makes it a little bit better so that you can even print it out if you want. Bring it with you when you're doing your research and tour the centers and say, hey, is this up to date? Because I will say that's the only downside about CMS is they're not always up to date. They're always at least 4 to 6 months behind, a couple of months behind. I'm not sure on the exact amount of time, but that way you can say, hey, well, what's your current? Because any skilled nursing center should be able to pull it up or tell you, oh, well, that's not current, but it's this now.
Right. So. And sometimes, as we know, in senior housing, senior living in general, management companies there may be a change.
Absolutely.
In ownership, management companies, or there's a lot of changes in some different things that have big improvements if there's something that there's a concern about. So,
of course.
That's always a very good question to ask as well.
That's true. The policies and the procedures depend on the ownership of the company. So sometimes that can be either a blessing or a curse, but asking that makes a difference too.
Absolutely. Absolutely. Well, this has been really great talking to you. Is there anything else that you want to add before we...
No, other than don't be scared. Just ask the right questions. That's all it is, and I think that skilled nursing and healthcare in general have kind of broken those barriers of skilled nursing. But if it can help anyone out there, just tell them not to be afraid.
Right.
They just have to do a little bit of research, or again, ask the right questions. When it's a fall or a hip and you're find yourself in the hospital, be ready with questions, because people like me are going to show up and tell you about our center. We're here to answer all those questions.
Right. And I did want to mention this one thing. Once you do choose a skilled nursing or rehab and you're in, there is someone that is an advocate for you once you're in that skilled.
It should be everyone.
Right. But there's someone that's considered like a case manager that you can speak to?
There's a social services director. Actually, to go through all of management, because if you are there doing a tour, so you have your administrator, your director of nursing, most places have an assistant director of nursing, and of course unit managers. So again, you'll have that short-term unit and then the long-term unit. So there should be a nurse manager on either side.
Okay.
You'll have your discharge planner, which again helps set you up for success when you go home and leave us. Then your social services director. Yes, that is going to be your advocate for everything in the center. If you need advanced directive type paperwork, they can help execute it for you. If you have items that you brought with you but you don't want to keep in your drawer, you want it locked up, well, we have special safes for that. Anything to just make yourself feel more comfortable, or you don't like your roommate, you want your room to change, tell the social worker. We'll get it set up. And I'm trying to think and of course admissions, that would be consider myself and then my internal admissions director to try to help get the auths and get a patient in the building. But yeah, it takes a team. It's like they say, it takes a village to raise a baby. Same for 100%. Seniors.
Yeah. I think it's always good to know that there's like a point of contact. So I think knowing that there's a social worker that can connect with each one of those different departments, that's not within a department. I think it's nice to know that you have that.
You'll have the social worker, but remember, everyone's there to help. And like I said, we're a team, we're a village. We all talk to each other. We have a morning meeting every day so we can talk properly about updates and what we need to do for each and every patient.
Exactly. Perfect. All right. I think that's it, unless there's anything else. But this was so informative, and I'm really hoping that the information that we chatted about and talked about today can be something that some of our seniors, their caregivers, their families are able to utilize to take some of that stress and any kind of anxiety about going into any kind of skilled or rehab facility off of their plate. And it just gives them a little bit of a better experience. So thank you for listening to us today. If you like this podcast, please visit us anywhere you listen to podcasts, and we have more information for you. Have a great day.
At Parish Healthcare, we believe every life is poetry in motion, motivated by strength and determination. As your bone, muscle, and joint healthcare partners, we believe in blending the art of healing with the science of medicine to keep your body in motion. We believe in healing patients, healing families, and healing communities. For a free orthopedic health assessment, visit parishhealthcare.com/orthoaware. Parish Healthcare, where the art of healing comes to life.